Hi friends, this is Dr. Abdequaem Chimthanawala. Today let me share a very interesting case which I came across, from which I learnt a very rare remedy which I had never prescribed in my practice, nor I had read about that remedy. But as I started reading Mater Medica, then I came to know about this remedy. It was a fantastic case that I came across. There was a person who came with pain in the abdomen, a lot of pain in the abdomen. The pain was very severe, very excruciating. He could not bear the pain. When there was pain, there was so much spasm in that, and it would last for some time, and again the pain would subside, but there was a constant dull pain also continuously. A typical, he described it as maybe a cramping pain. Doctor Sahab, he gets a lot of cramps, and sometimes it will, Doctor Sahab, there is a lot of gripping pain in my abdomen. So one asked, he came actually after being treated by 3 or 4 other doctors also, but till he was taking medicines he felt better. When he stopped, he was again back to square one. I said, anything else you would like to add? Now after the history, he told a lot of things about the pain in the abdomen, the gripping pain in the abdomen. Sometimes the pain is in the middle, sometimes on the sides, or sometimes the whole abdomen. Sometimes the pain is present with fullness in the abdomen, and because of pain sometimes he feels so prostrated he has to lie down because of that, and all sorts of pain, and a lot of adjectives used because of pain symptoms. On inquiring further, he gave the history that he's working in a factory, and he's absolutely okay. The stools are okay, the urine is okay. He gets normal stools in a day, and he said, whenever there is pain, I feel that I'm dizzy. Otherwise, if you tell me, I'm absolutely fine. That's why people sometimes, he told that's why people sometimes feel that I am just I'm just basically trying to say that I'm diseased, but I am not, because all the reports are normal also. Sometimes the people feel that I'm acting. Actually, I don't have any pain, but he said, sir, I have this pain. Whenever there's pain, I take a painkiller and then I go to work. So medicines were given by resident doctors. There was change only till he took the medicine. So he came to me and said, sir, this has been my life. Till I take the medicine, it's okay. When I stop, it is back to square one. Then I asked him exactly what do you do in your life? So he told me a very beautiful thing in that. And this is why I tell you, the history taking of the patient is very important. Right from the name till the life space, till the mental history, everything has to be studied so accurately. That's what it is told that homeopathy is a science, but prescribing is an art. You have to be very artistic in prescribing and a very keen observer. He says that he is working in a battery factory, a recycling battery factory. He's a worker there, a recycling worker there. He recycles battery and all. Now, apart from the whole case, I found this point very interesting because the rest everything was covered. Now, if you are working in a battery where it is recycled, what exactly the patient was trying to tell us? In a battery, the most important chemical or material used was what? Lead. Yes, my friends, lead. So immediately it struck my mind that it may be a lead colic. And in lead colic, if you see in your writings, it is written that the pain is cramping and gripping, everything with the patient suffered from. So I examined the abdomen, and the abdomen, there was pain, but the abdomen was absolutely soft. So there was nothing in the abdomen as such. But now lead colic, you have maybe plum, you can have other drugs, but then this patient was a classical patient working in a battery recycling factory. So as I repertorize this case of lead colic, I put in that repertory, I put pain, cramping and gripping, and a very rare drug that came in the repertory sheet, and that was Uzara or Uzara. Uzara or Uza. Now I was surprised. I've never read about this drug, but this drug, it came and I read about the symptoms, and it exactly matched what the patient was trying to tell me. The symptom which I took for prescription was pain, cramping, gripping, and late colic. These are the only 2 symptoms I used for prescription, and to my utter surprise, this Uzara worked so miraculously. Uzara 200, 2 doses at an interval of 3 days. The first day I gave him, he was much better. Slight pain he suffered. The third day also gave him Uzara 200, 1 dose. Then he came, then he did not come at least for 15 days. I thought maybe he has changed the doctor, but he came after 15 days and said, "Sir, wonderful. I have no pain till date. I'm absolutely better. There is no cramping, no gripping, and for the first time in about 2 years' time, I am pain free. Even I don't have dull pain in the abdomen for at least 15 days now." But he told me, "Sir, please continue the same medicine so that I don't get pain." This is how I was able to treat that patient with Uzara, and I learned something about Uzara, that is late colic, and second was pain, cramping, and gripping. And he was working in a recycling battery factory. So this is, my friend, a case of late colic with Uzara. One more case I would like to share, again a very rare case. This lady was a pregnant lady. She was carrying for the 6 months, and she came to me, "Okay, sir, there is pain in the uterus. There is so much pain in the uterus that I can't bear, and I have to take painkillers because I am pregnant, I can't take a lot of painkillers, and I fear that it will miscarriage might occur." And now she had already shown to some gynecologist, and she had given us some painkillers, but till the time she was better and she stopped the painkillers, she was back to square one. And even the doctor was worried, even the patient was worried, even the family persons were worried that if the pain continues, so much severe pain, she will land up in a miscarriage, or the fetus will be aborted. And as for it was the first child, the patient was very anxious also. So somebody referred her to me, and she was only stressed because of their pain. She was only telling me, "Sir, just treat my pain, everything is okay, I am mentally fine, there is no stress, my thirst is okay, my food is okay." Because she already knew that I asked a very long history, so she was not ready to give the history also. She was only concentrating on the pain. Now we had only 2 symptoms in this case, that is pain, cramping in the uterus. But when? Pain, cramping the uterus during pregnancy. She had uterine pain. She did not have abdominal pain. She had pain in the uterus. So as we all are very aware that if you get the symptom, then you have to see whether it is present in the books of the repertory. So I again put the symptom in the repertory. It is pain in the uterus, cramping pain during pregnancy. And my friends, there are only 2 drugs in the repertory. One is Cuprium ars, Cuprium arsenicum, and the second is Uzara or Uzara. And I immediately thought of the patient who had cramping pain and the gripping pain in the abdomen, the late colic one. So I was first very sure that this type of pain I have already cured a case, so I gave that patient Uzara. Uzara 200, 2 doses, one morning and one in the night. And the patient came on the 3rd day with her husband, with her in-laws, and they were so happy. They just gave me a bouquet. "Sir, the pain has gone, but make sure, sir, you repeat the medicine so that I don't have pain for the next 3 months, so that I can deliver a normal child. A normal delivery should take place." This was Uzara, an eye-opener for me. Pain, cramping in the uterus, pregnancy during, pain, cramping in uterus. Uzara 200, 2 doses, the case was cured. So in this way, from the 2 clinical cases, I learned about Uzara or Uzara. So my friend, this is how you have to develop your Mater Medica. As I always say, homeopathy doctor has to be a keen observer. Always learn what the patient is trying to tell you. Give the patient some time, give him some hearing, so that you can get accurate symptoms from the patient, and then you can convert into rubric form, or you can see in your Mater Medica and keep reading, because these drugs we never read in our college days or in our practice. It happens that sometimes some symptoms click in the repertory and then you prescribe. So Uza, remember 3-4 symptoms: pain, cramping, gripping in the abdomen is soft, lead colic, pain, cramping in the uterus, pain, cramping in the uterus during pregnancy. This was the symptoms I learned about Uzara. And one more symptom that is given in Mater Medica, that is dysmenorrhea. Of course, if there is so much cramping in the uterus, the drug can be used for dysmenorrhea. So my friends, this is Uzara for you. If you like the video, please do share and subscribe. Thank you.